Hi, if you have diagnosis of epilepsy and you were prescribed anti-seizure medications, there are multiple reasons why some people do not take their anti-seizure medications. So today we'll talk about why some people do not take their anti-seizure medications and what happens if we do not take your anti-seizure medications. First of all, the diagnosis of epilepsy happens when we have spontaneous seizures without any obvious trigger that happens 2 or more times. So if we have 2 or more seizures that are unprovoked, we can make the diagnosis of epilepsy if they are more than 24 hours apart. And we even can make the diagnosis of epilepsy if we have one seizure and the testing like brain MRI and EEG shows abnormalities that are consistent with epilepsy and excess electricity in the brain. If we have one seizure that is unprovoked, your chances of seizures coming back is still high, and usually it runs between 25% to 45%. Those informations are all in details in this Mayo Clinic epilepsy treatment book that I had the chance to write one chapter about the first time seizures and how we can deal with seizures for the first time. And also we learned that if the seizures are unprovoked and the testing shows that you have abnormal electricity in the brain and maybe abnormal MRI or abnormal exam, that increases the chances of seizures coming back significantly. Or if you have 2 seizures, then the chances of seizures coming back is much higher. It can reach up to 70%, and then it is just a matter of time until the seizures will come back and get more and more with time. What happens if seizures are left untreated, then they will get more and more with time. They will start once a year, and then they will come every 8 months, and then will come every 6 months, and then will come every 2 months, and then once a week, and then after that maybe every day, and even worse. So seizures are kind of like every seizure will trigger the next seizure. And the seizures actually, with research, we found that they can trigger some changes in the brain and induce new stem cells in the brain that are irritable, and they cause more and more seizures. And there is a network in the brain that gets stronger and stronger every time there is a seizure. So ignoring the seizures and hope they will go away, it will not happen, unfortunately. So it's kind of like leaving your bathroom with mold in it, and the mold is keeping growing and growing, and you just ignore it and hope that the mold will go away. So you really need to get to the bottom of this problem so that the seizures will stop and the mold will be clean. And here comes the anti-seizure medications. The job of the anti-seizure medications is to calm down the electricity in the brain, control the seizure focus, and control the network so that hopefully dismantle this network and the brain literally forgets how to seize, and then you have a good control of your seizures, and maybe in the future you can stop your anti-seizure medication successfully in some cases. There are a few reasons why people do not take their anti-seizure medications. The first reason is that people might not be convinced about their diagnosis of epilepsy, and sometimes I don't blame you. So if you go to a neurologist or a doctor and they just say oh, they see you and they kind of just do superficial exam and they just tell you take this medicine without investing the time to explain to you what you have, why do you need to take the medicine, how long you need to treat, what are the evidence of the condition, why we made the diagnosis of epilepsy. So if you're smart, if you're not convinced that you really have epilepsy and this is a solid diagnosis, then you might question the diagnosis and not take the medication. And maybe it's the right decision to be on medications, but the doctor did not invest time and efforts to explain that. And this is what I'm trying to do here in the channel, explain epilepsy in detail so that you take better care of yourself and your loved one. The second reason is that the medications are causing too many side effects. It is well known now that the older anti-seizure medications, they have lots of side effects and they hit multiple organs in the body. They can affect the liver, they can affect the brain, the memory, the slowness, they can affect the skin, the kidneys, all of that. They can cause allergic reactions. So they have lots of side effects, and some people do not tolerate these side effects. So sometimes we need to decrease the dose or even switch them to a completely different medication. So discuss with your neurologist if the medications are causing too many side effects for you. We have alternatives, and we have medication that cause psychiatric side effects like anxiety, depression, PTSD symptoms like levetiracetam or Keppra. It is important to realize that and avoid it or get another medication that is better fit for you. And not all the symptoms of epilepsy and the brain condition are from the medications. So it is important to understand that sometimes there is a problem in the brain itself. So memory loss is associated with epilepsy, cognitive side effects, some developmental delay. Sometimes there is a process that caused epilepsy and caused other neurological conditions. So maybe there is a genetic process, or there is demyelinating process, or there is a brain decay over time. And all of those are causing those neurological conditions and side effects, and not necessarily they're from the medicine, but they are from the condition itself. So it's a kind of discussion between you and your neurologist if those side effects and what you are experiencing are because of the medicine or not. And maybe like a child was not doing well in school, or they have developmental delay, and the problem is not because they have medication side effects, it's their epilepsy or their brain development is delayed. And the third possibility is that the medications are too expensive, they're not affordable, they're not available, and sometimes they just go out of production and we don't have availability in the local pharmacy. So it is very important to discuss those options and make sure beforehand that your insurance will cover the medicine, or you have enough money and resources to take the medicine, it is available for you, and not prescribe a medicine that you cannot get. And also, if the medication is coming to an end or there is any problem with the production, to be able to have a plan B if the medicine is out of stock. What can we do alternatively? And it is important when we discuss the treatment of epilepsy to individualize the treatment based on the patient's own background. It is very important to take the right medication for the right epilepsy and for the right background of the patient. And to learn all of that, you can see this video for all the details about this epilepsy and how we can pick the best medicine for you. And stay healthy, and see you in the next one. Salam.